So this is the kind of the lecture, all the misfits go in here really. So we're talking about dental and ocular, but also we've got testicular blocks in here as well. So if we're thinking about dental cases, we need something really rapid onset, and ideally we want long duration of action because we want to encourage eating in our patients post-surgery. We need to think about the volume we're using. This is probably one of the main cases where you need to think about your only using your maximum toxic dose. If you're talking about a cat and you're doing multiple blocks, you might well be doing multiple blocks both sides if you're doing a lot of extractions. Should we be concerned about doing bilateral blocks? No, not really. I've done bilateral mandibular and bilateral maxillary blocks without any problems post-operatively, so that's not something I'm worried about. We need to be a little bit careful. I said injecting into canals. This is mainly in reference to the infraorbital nerve block, which we'll look at, because there's not a lot of room in those canals. And one of the techniques, hopefully we'll practice this afternoon, is a slight variation on that technique that we'll elaborate on. So on our dog skull here, we have our maxillary nerve here running through our pterygopalatine fossa, and that's just caudal to this arch here. It just runs through the infraorbital canal and emerges as the infraorbital nerve here. Down here we have the mental nerve, which is quite a difficult one to block, and further at the back we have the mandibular or inferior alveolar nerve, which is a pretty easy block to perform. You just see here on these specimens, this is the medial aspect of the jaw, and this is the mandibular foramen here. That's the target for our needle, and that's just the lateral aspect where that's the mental foramen there. And you can just see where it puts into perspective in the complete picture up there. This is what's called the intraoral approach to the mandibular nerve, which personally I find really difficult to do in anything but quite a big dog, because you're trying to get your finger in there and feel the nerve, then you're trying to guide the needle without stabbing your finger but getting it in the right place. So this block is described, but I don't tend to take this approach so often. My preferred approach here is where we have the needle here coming in. It would be ventrally, but lateral if the animal's in lateral recumbency, which is pictured here in the next slide. Okay, so this is the angle of the jaw here. The mandibular foramen is probably about here, and you're just directing your needle through. And what we'll do this afternoon, the practical, is I put my finger in the mouth and just direct the needle towards my finger, and you can feel the nerve. It's just exactly the same as the dentist does when he's doing a mandibular nerve block on you. He's got his finger in there feeling where the nerve is. And it's a really nice one to feel in dogs. You can flick it around and you know that you're in the right place. And you can actually feel when you inject, you feel the cold of the local anaesthetic injecting. And if you're not in the right place, you feel the local anaesthetic dribbling past your fingers. With the maxillary nerve, as I said before, this is the pterygopalatine fossa. As well as the nerve in there, there is a venous plexus. So this is one of those nerve blocks where you put the needle in and leave it. Don't wiggle the needle around once you're in there, because you will hit a blood vessel. It's not very exciting in dogs, but when you do that on a horse, that's really exciting. So, because we normally use a spinal needle in a horse for that. Oh, and the little markers have moved around on that picture. So you can just about see this is the zygomatic arch here, and you're just dropping off the back of the zygomatic arch and popping the needle in perpendicular to the skin there. If you hit bone, stop, connect up, aspirate, inject, and get out of there. This is the same block, but with this dog in sternal recumbency. So this is a dog about to have rhinoscopy and biopsies up the left-hand side of her nose. So we're doing a maxillary nerve block in her. And you can see the length of that needle. That's about a 1-inch needle. So she's about 45 kilos. So you have to pick, depending on the size of your patient, you choose the length of your needle accordingly. And we're just putting that needle right in parallel, sinking that pretty much up to the hub, and then we'll connect up, aspirate, and inject our local anaesthetic. And then she has her rhinoscopy. She didn't react at all to that rhinoscopy. In a cat, probably easy. We do have a cat this afternoon, which is quite a luxury for a local anaesthetic course. So hopefully we'll all get to palpate this landmark on a cat. But again, it's a really, really easy landmark with cats as well. And this was actually a cat that we would take. It had a polyp, a pharyngeal polyp. We've done bilateral maxillary nerve blocks for that cat because the surgeon needed to split the palate to gain access, and that provided really good analgesia for that cat. This is going a little bit further forward and is quite a popular block with dentists, is the Palatine block. The Palatine nerve runs all the way along here, and if you were going to do any surgery to the hard palate, so cleft palate surgery, or removing any masses, anything like that, the Palatine block would be a good block to do. If you look at a skull, I'm not sure I've got a picture of a skull actually, you can see on the skull the Palatine foramen is around about there, so you're just lining up with the last tooth there and going 2 to 3 millimetres in from that. The infraorbital nerve block can be performed in a variety of ways. So you can either go through the skin, or as in this photo, you can lift the lip and insert the needle near to the foramen. What we're discouraged from doing really is sliding the needle all the way into the foramen, because obviously our needle's quite sharp and we could damage the nerve. And we're trying not to damage the nerve with our local. So if you can do it with just a needle, you want to palpate the foramen and just inject around the foramen. There's a newer technique that's described whereby you just use, for a dog like a Labrador size, you'd either use a blue intravenous catheter and you just slide the catheter all the way up the infraorbital canal. And if the catheter's long enough, depending on the size of the dog, you can actually get all the way back up the canal and block the maxillary nerve back here. So that's a new technique which we'll have a play with this afternoon on these cadavers. This is in a cat performing, again, the infraorbital nerve block. And you can see here from the skull, that's where the cat's infraorbital canal is. So it's really close to its orbit, so you just need to be quite careful. And actually, for me, in a cat, I'd rather do a maxillary nerve block than do an infraorbital nerve block. You can see this is the intraoral approach. You're just palpating that foramen quite high up. Just as an example, I've got this in dental work in a cat, pre-med for cats. I tend to prefer alpha-2 pre-meds in cats in combination with an opioid such as buprenorphine or methadone, an NSAID, maintenance ISO, local regional, a combination of maxillary and mandibular nerve blocks. So I think rather than trying the infraorbital and the mental nerve blocks in cats, it's just much easier. You've got a lot more to work with if you do the mandibular and the maxillary nerves further back. And you can quite happily do those as paired blocks on both sides, and that's all the analgesia you need for your cat dental if you're doing work on both sides.
And if you're doing bilateral blocks, is there a risk of the dog or cat causing suction to the tongue?
I haven't. That's the main caution that people often say, and I haven't experienced that problem when I have done bilateral nerve blocks. So, no. And dental colleagues who have much more experience of those cases than I do, they're quite happy doing them as well, so no.
I did an online course for Australia a couple of years ago and stuff, and they were using lidocaine instead of bupivacaine because of the shorter action. They were saying that it would do it off quicker and before less likely to get the dog chewing its tongue and stuff.
Yeah, like I said, I haven't had any problems with using bupivacaine, but yeah, I mean, you could use, if you were worried about it, you could use lidocaine, so yeah. Moving on to ears, I talked before about ear surgery, specifically total ear canal ablations, and what I tend to do is quite a local block. So this is the auriculotemporal and the auriculopalpebral nerve, which in theory they're there and you can block them. It's quite difficult to actually locate those. You just feel either side of the ear, as I'm doing in this dog here, and you can feel the vertical canal here, and I tend to go either side in a V shape. and infiltrate around the area. They can be quite difficult to locate landmark-wise, and what I tend to do is go quite deep and then inject as I draw back, which we can do in the practical this afternoon. But those tend to work quite nicely. If you're doing something like total ear canal ablation, then obviously the facial nerve runs through there, and there's always a concern if the dog has facial paralysis after the surgery, is it caused by surgical damage of the nerve, or is it still the nerve block? Well, if it's nerve block, you're going to find out when the local anaesthetic wears off. I do these blocks all the time with the 2 surgeons I work with, and they're very experienced at doing TICAs, so they're not so worried about it. But it's a concern that I have had voiced to me before. So. And we talked about that in the last lecture, didn't we? Okay, so retrobulbar nerve block. These are, again, quite nice, easy nerve blocks to do for things like enucleations. And this approach described here is what we call a 10-to-4 approach. So if you're actually looking at the dog, that would be the 10 o'clock position, and the 4 o'clock position would be down here. And that's just with an inch-long blue needle, and I just apply a slight bend to the needle, and then you just almost bounce it around the back of the orbit, and then you can see the needle sunk right in there, aspirate and inject, and then repeat again in the 4 o'clock position there. And this dog was having an enucleation. You would be cautious about this if there was any infection, neoplasia, if that was the reason why you were removing the eye in the first place, and particularly if there's a coagulopathy as well. A coagulopathy is a contraindication to all local nerve block techniques. This is a curved needle that they have in people, and that can just help place the needle rather than having to put your own bend on it. There's already a bend on that needle. One of the things that you can do, depending on how well your nerve block works, if your retrobulbar nerve blocks works absolutely fine, you don't need to do anything. But let's say either you haven't performed a retrobulbar or it hasn't worked. Once you've taken the eye out, you can just do a splash of bupivacaine into the space that you've left behind before closing the wound. Obviously, with a lot of splash blocks, a lot of surgery is performed prior to you actually doing the block, so your analgesia up front needs to be really good in order to compensate for the fact that you're doing it kind of halfway through the surgery. And testicular nerve blocks, easy peasy. You just take some local, inject it into testicle, and then off you go. There was a study from the University of Cambridge, and they looked at isoflurane requirements in patients undergoing dog castration when they used an intratesticular nerve block versus those they didn't. They showed they used a lot less isoflurane in the patients that had the nerve block. So it does seem to make a difference putting local into testicle. So those are all quite easy techniques, especially good to practice in dogs, and then the maxillary and mandibular ones are really easy to do in cats and do massively improve their comfort post-operatively. So, yeah, all for dental nerve blocks.